Hi, how's it going? I'm Dan Reddington, physical therapist at OrthoNorCal, here with Dr. Cagle.
Hello, I'm Dr. Robert Cagle. I specialize in joint replacement surgery of the hip and knee here at OrthoNorCal.
And we're going to be talking a little bit about strengthening the knee after a total knee replacement here. So we're going to have Dr. Cagle lie down on the bed right here. And we're going to start with the legs straight. First thing you're going to notice after this total joint replacement here is that quad muscle, the muscle in the front of the thigh here, is going to be a little bit lazy. That's going to be due to some pain, some swelling, some trauma to the joint from the surgery. Our first goal with our strengthening is getting that quad muscle to start firing again. First way we're going to do that is an exercise called a quad set. With a quad set, we're going to have the legs straight down on the table here. All we're going to be trying to do here is tighten this muscle. So we're going to give a big squeeze and then relax here. Good. When we do this here, when we're tightening that muscle, we don't want to see the knee start to lift up off the table at all. We want to think about keeping that knee as straight as possible and going with another squeeze here.
I always try to word it, you want to try to push your knee down through the bed when you're doing this exercise.
Perfect, perfect. Once we feel like we've got that quad starting to pump a little bit, we're going to make it work a little bit harder with our next exercise, which is going to be a straight leg raise. For a straight leg raise, the leg that we're not working, we're going to have bend right here so we're nice and comfortable, and that's going to protect our low back a little bit here. So with this exercise, we want to tighten that quad muscle so we can see that big muscle bulk right here. We're going to keep that knee straight. We're going to point the foot back towards us a little bit, and we're going to lift this leg up in the air until this knee is even with our bent knee. We're going to pause for a second there, keep this quad muscle tight as we lower all the way back down, squeezing that muscle. Once we're flat on the table, I want to relax that quad muscle. We're going to squeeze again, reset there, the toes are pointed back towards us, and we're going to lift up again, repeating that motion, and then coming back down here. Typically, I like to do these in sets of 5, making sure we're taking a little break between each rep and giving ourselves a good amount of time between each set so that that quad muscle can recover and be strong for the next set. Typically, I like to do this 3 sets of 5 a few times throughout the day here. One thing that you're going to see here is when this knee is being, or when this leg is being lifted up, the knee is not bending at all. Dr. Cagle is doing a great job of keeping that knee completely extended both when he's lifting up here and also when he is lowering back down. Excellent. Good. We're going to have Dr. Cagle sit back up here, and we're going to swing the legs around the side of the table here. Once we feel really good with our straight leg raise, we feel like that quad is kind of pumping a little bit. We're now going to work on some long arc quads here. So from this position right here, we're just going to be up tall, chest is shown, and we're going to work on just straightening that leg, bringing that foot up towards the ceiling, and then back down. Dr. Cagle here is doing a great job of not letting his body starting to fold here. He has that chest up high, and we're just working on feeling this quad muscle squeeze as we lift and back down. You may also feel a stretch through the back of the knee when we're lifting up here. Similarly to the straight leg raises, we can do about sets of 5 with these to start. 3 sets of 5 a few times a day, increasing as we feel like we're getting stronger, we're able to tolerate more motion. All right, we're going to be talking about an exercise called a terminal knee extension here. This is a good exercise to be able to get the quad working a little bit more with our foot on the ground here. So what we have is a band that's looped around behind the knee and then tied up right here. That's going to provide some resistance. These bands, they're called TheraBands or Sanct bands, can be found online. You should be able to find them on Amazon. When we're thinking about the color of the band, the lighter the color, the easier, the less resistance it is. The darker the color, the stronger, the more resistance it's going to be giving us here. So what we're going to be doing here is starting with our involved knee bent here. We're going to be holding a stick here. The stick is going to do 2 things for us. Number 1, it's going to make sure we're not falling over. Number 2, it's going to cue us to stand up tall here. During this exercise, we always want to have the chest up. We don't ever want to be hinging down towards the ground here. So we're going to be up tall with that leg relaxed a little bit. And what I want to do here is squeeze that quad muscle and straighten the knee all the way out. Good. We're going to hold in this position for 5 seconds right here. And then we're going to bend again. We'll perform 5 reps here, squeezing that quad, pushing that knee back. We want to really feel the quad working and keep the chest up tall. Now with this one here, in addition to feeling the quad working, you may again feel the stretch through the back of the knee as we're starting to stretch that out a little bit more here.
And you can definitely feel the muscle firing as it goes. That's what you want to concentrate on.
Excellent. As we're progressing through our strengthening on the ground here, we're going to work on some calf raises. So as we're doing calf raises here, we want to be standing up tall at a stable surface. We're going to keep our knees straight, we're going to keep our chest up, and we're going to lift up onto our toes, and then control back down here. And we're going to come on back up again, keeping the knees straight, keeping the chest up. Again here, we're going to do about 5 reps to start. We can get 3 sets in there. We can do them a couple times throughout the day, making sure that we're getting up and moving a little bit.
And again, as I'm doing this, I can feel that pinch and burn in the back of my calves, and that's what you want to be striving for.
All right, here we're going to work on a sit-to-stand exercise, which is going to have a couple different benefits. Number 1 is going to help us get stronger after surgery. Number 2 is going to help us get prepared for activities of daily life after surgery here. So in this setup, we have a strong, stable surface in front of us here. We have a strong, stable chair that we're going to be working with, and a couple objects here on that chair to bring the surface up to us. This is going to be a good starting position. As we get stronger, we're going to be able to take some of that support away from us beneath. But we're going to be sitting down here, and then just standing right back up here, pushing through the feet, pushing through the legs to be up tall. We want to try to keep our chest up as much as possible here. We can start off by using our hands on that surface in front of us to give us a little assistance. As we get stronger, we can take our hands away. And we can also begin to take the surface a little bit lower, so we'll be working a little bit harder, eventually getting to the point where we're standing up from the chair and back down. Awesome.
If you have any questions or concerns, we're always here to help in any way possible. If you're a new patient to the practice, we would love to see you and discuss how we can help you and better your life and get back to the high quality of life that we strive to give here at OrthoNorCal.
Remember, post-operatively, the key is to work hard and be diligent with all of your exercises. Thank you.
And last but not least, remember, you're not going to break anything. Pain is just unfortunately part of the deal when you're rehabbing a joint replacement surgery. You won't break anything, you just got to get through the pain. Thank you again, and have a great day.